Welcome back to the deep dive. This is where we take your sources, the materials you send us, and really dig in.
Yeah, pull out the key stuff.
Exactly.
Yeah.
Extract the absolute essentials you need to know. Today we're tackling, well, it's a universally relevant topic, but one that often gets, a bit awkward or maybe filled with bad info.
Okay.
We're focusing on sexual health and vitality, specifically looking at men as they navigate life over 60.
A really important stage.
And we've got a fascinating set of materials for this deep dive. It's basically a distillation of advice, observations from doctors, other experts, people who specialize in men's health and specifically sexuality as we age.
So not just guesswork.
No, not conjecture, not old wives' tales. This is grounded in, professional medical perspectives, real experience.
That's crucial for this topic.
Right. Our mission, pretty straightforward. We're going to meticulously go through these sources, pull out the most important, actionable insights. What are the common pitfalls? The easy mistakes to make. And on the flip side, what are the healthy practices that the experts actually recommend?
Getting practical advice.
Yeah, and it's not just clinical facts, right? It's about understanding the natural changes that happen. That's key. And more importantly, how you can maintain a healthy, fulfilling sex life, throughout your years.
At any age, really.
It's vital, it's normal, it's a positive aspect of overall well-being, and thankfully there's a solid expert-backed guidance available, which is what we have here.
And that last point you made is so key. Sexuality isn't some kind of optional extra that just, vanishes with age.
Right, it doesn't just switch off.
No. It's a fundamental part of being human, of our well-being. And it persists. It changes, sure, but it persists throughout life. And while these specific sources we're looking at today, they do focus on men over 60. Honestly, you'll probably find that many of the principles we discuss, they apply much more broadly.
Like what sort of thing?
Well, things related to body awareness, the connection between your general health and your sexual health, which is huge, and also your mental perspective, how you approach it. These are pretty universal, really.
Okay.
What makes this material so valuable and why we're diving deep is that it moves beyond just, anecdotes or maybe outdated stuff you hear around.
Locker room talk, yeah.
Exactly that. This material gives concrete, specific guidance. It points out precise mistakes that experts actually see men making.
Okay.
And it outlines positive, evidence-based steps you can take instead.
Actionable stuff.
Actionable stuff.
Yeah.
Ultimately, this deep dive, it's for you. It's about giving you reliable information straight from these expert perspectives.
Yeah.
Helping you navigate what can be, a sensitive area of health.
Right.
Helping you do that with awareness, with confidence, and with the best knowledge we can pull from these sources about your changing body and needs.
Okay, so the source material we've reviewed, it really zeroes in on one specific, maybe surprisingly specific aspect of male sexual health. Solo sex. Masturbation. The experts cited, they've outlined what they call 7 masturbation mistakes men over 60 should avoid.
Right. A very focused topic.
It sounds narrow, yeah. But as we'll see, these points, they actually touch upon much broader themes. Things like physical health, mental well-being, understanding your body as it changes, and even the interaction between solo sex and partnered sexual health. It's actually more comprehensive than it might first appear.
Definitely connects outwards.
So let's jump right in. Mistake number 1, identified in this expert material.
Let's do it. And the experts, they kick off their list with something very physical. A physical mistake, but one whose consequences can, ripple out over time, affect the whole experience.
Okay. Mistake number 1, according to the doctors and experts highlighted, using excessive pressure or overly rough techniques during solo sex.
Exactly. And the reason this becomes such a significant issue as men age, it's rooted in basic physiological changes. It's just biology. The experts point out that with aging, the skin, especially in sensitive areas like the penis, it tends to thin out. It's not usually dramatic overnight, but it's a gradual thing.
Right.
The underlying tissues lose some elasticity, some resilience, collagen, elastin reduction, that sort of thing.
Okay.
And at the same time, the nerve endings, they don't necessarily disappear, but their sensitivity can change. Sometimes they actually become more reactive or even easily irritated by strong stimuli that maybe were fine, even necessary when you were younger.
So what used to work might now be too much.
Precisely. What felt maybe necessary for intense stimulation in your, say, 20s or 30s In your 60s and beyond, it can actually be too aggressive.
Yeah.
Your body's tolerance for that kind of forceful approach just diminishes.
Right.
It's less able to bounce back quickly from too much friction or pressure.
That makes a lot of sense. The body just isn't quite as resilient, is it? Like you wouldn't handle, I don't know, silk the same way you'd handle canvas.
Perfect analogy. And a really key point the experts highlight here is a potential long-term consequence of consistently using too much pressure or rough techniques.
Okay, what's that?
Desensitization. And they don't just mean temporary numbness right after, they mean the nervous system, the brain, actually learning to only respond to that really high level of intensity.
Like you're training it the wrong way.
It's a form of sensory adaptation. Yeah.
Yeah.
That constant input of high pressure stimulation can essentially make the brain turn down its sensitivity to lighter, more nuanced sensations.
And the implication drawn in the material then is that this desensitization could make it harder to reach orgasm or maybe even feel pleasure with a partner, where you might not use or want that same level of aggressive technique.
That's the clear concern the experts raise.
Yes.
If your system gets conditioned through repeated solo activity with excessive force to only register very intense pressure as pleasurable, then the more varied, often gentler, and definitely more interactive stimulation you get in partnered sex might just not be enough.
Yeah.
It might not trigger arousal or orgasm effectively.
Wow.
So it directly impacts your ability to connect sexually and find pleasure with someone else just on a purely physical level. This isn't just about solo technique. It really has implications for your ongoing sexual health and enjoyment, whether you're alone or with a partner.
I really like the analogy the material uses here. It says, think of it like tuning a vintage guitar. You don't crank the strings, you finesse them.
That's a perfect metaphor, isn't it? It really captures the shift in approach that's needed.
Yeah.
It moves the focus away from, say, brute force, which, let's face it, can be part of youthful sexual energy towards nuance, patience, and care.
Finesse.
The core recommendation from the experts is simple, but it takes conscious effort. Go easy, be gentle. It's about adapting your technique to where your body is now, respecting the changes, and discovering that pleasure doesn't always require aggressive action. It's about finding the right touch for the body you have today, not trying to force it to respond like the body you had decades ago.
Right.
And this adaptation, it isn't presented as a compromise. Often it's actually a pathway to discovering new kinds of pleasure and just maintaining comfort and function.
That reframing from force to finesse, that feels significant. It's working with your body's evolution, not fighting against it.
Okay, let's move on. The second mistake identified. This one touches on something, well, increasingly common in our digital age.
Yes. The second mistake highlighted by the doctors in these sources is over-reliance on pornography.
Right. And the material is it makes a point of saying up front, we're not saying porn is evil. It's not a moral judgment.
Absolutely not. The experts aren't issuing some kind of blanket condemnation of porn itself. Their concern, the issue they identify as a mistake for men in this age group, is becoming dependent, specifically on the visual stimulation from porn.
Dependent how? Dependent on it to initiate arousal or maintain it, or maybe even just to reach orgasm.
Okay.
They explain this by referencing how it, and I quote loosely here, can mess with your brain's reward system.
The dopamine hit.
Basically, yes. The brain's reward system learns what stimuli are most potent, most available. And online porn often provides this constant stream of novel, visually intense, often quite extreme content.
Right. It's designed to grab attention.
Exactly. And the brain can get conditioned to prefer these hyper-real, easily accessible visual cues over the more subtle, more complex, maybe less immediately gratifying stimuli involved in real-life intimacy.
Which involves more than just visual.
So much more. Touch, emotion, imagination, smell, all of it. Porn dependency can create this sort of hierarchy of arousal in the brain, where natural or partner stimulation just doesn't register as strongly compared to that high-voltage input from a screen.
And the experts use a very specific, maybe slightly alarming term here. They state this over-reliance can lead to porn-induced erectile dysfunction. And they emphasize, yes, that's a real thing.
Yeah, that direct phrasing, I think it's meant to underscore that this isn't hypothetical. It's something clinicians actually observe.
Wow.
And the mechanism ties back to that desensitization of the brain's reward pathways we just talked about. When the brain gets used to the immediate, varied, often exaggerated visual stuff in porn, it can become less responsive to the cues present during partnered sex. You know, your partner's touch, their smell, subtle movements, even just the emotional connection.
Right.
And this reduced responsiveness can actually show up as difficulty getting or keeping an erection with a partner, even if solo arousal with porn is still fine.
So it creates a real disconnect between solo activity fueled by these specific visuals and partnered intimacy, which relies on a much wider range of cues.
That's the core issue identified.
So what's the recommended alternative from the experts?
Right.
They suggest balancing solo time with imagination, mindfulness.
Exactly. The goal, as they put it in the material, is to reconnect with how your body feels rather than what your eyes see on a screen. And this is where incorporating mindfulness can be really important. It's that practice of bringing your attention deliberately to the present moment without judgment.
How does that apply here?
Well, in a sexual context, it means consciously shifting your focus inward, paying attention to physical sensations, textures, warmth, internal feelings of pleasure, maybe using imagination or memory instead of purely external visuals.
That's a significant contrast, isn't it? Focusing purely on external visual input versus cultivating internal sensation, awareness, imagination. It's like the difference between looking at a photo of a meal and actually, tasting and smelling the food.
That's a very apt comparison, actually. It's about engaging a broader range of your sensory and cognitive pathways for arousal.
Right.
Look, visual input is a natural part of sex for many people, but an over-reliance on one specific, often extreme type of visual input, that can create problems for responding to other kinds of stimulation, especially those crucial for partnered sex.
So diversify your stimuli.
In a way, yes. The experts suggest that balancing different types, visual, tactile, imaginative, emotional, internal sensation, it fosters a more adaptable, robust, and ultimately healthier sexual response. One that serves you well, both alone and with a partner. It's about keeping your arousal system flexible and responsive to the real world, not just, a curated digital one.
That's a powerful point, thinking about sexual responsiveness as something flexible and adaptable, and that it's not just mental, but has these tangible roots in how the brain learns. Okay, let's move to mistake number 3. This brings us to an area many men might feel uncomfortable with, maybe unfamiliar, but the experts really emphasize its importance.
Indeed. Mistake number 3, as identified by the experts, is ignoring prostate health, particularly in the context of solo sex and overall well-being.
The material is pretty direct here. It states the prostate plays a huge role in male pleasure, especially as men age.
They don't mince words, no. The prostate gland, it's located just below the bladder, surrounds the urethra. It's heavily involved in producing seminal fluid, but it's also rich in nerve endings. And for many men, stimulation in this area, which you can often access externally through the perineum or internally via the rectum, it can be a source of intense pleasure. Sometimes even a different kind of pleasure, maybe deeper, more whole body than just penile stimulation.
Right.
The experts do acknowledge the common discomfort, even taboo, around exploring this area. It's often thought of only in terms of medical checks, right? Like PSA tests or digital rectal exams, not pleasure.
Yeah, definitely.
But they directly counter that discomfort. The message is clear. Stimulation in this area, if approached safely and comfortably, can actually improve orgasms and potentially contribute to prostate health.
So it's not just about pleasure.
Not solely.
Yeah.
The idea isn't that everyone must stimulate their prostate for pleasure, but ignoring this significant anatomical area entirely might mean you're missing out on potential pleasure and potential health benefits that are mentioned in the literature.
And they include a crucial health link here, don't they? Backed up by research references. They say, regular ejaculation, including through masturbation, has been linked to a reduced risk of prostate cancer, according to several studies.
This is maybe the most significant, and for some, maybe the most surprising point related to prostate health and solo sex in the material.
Yeah, I think many people wouldn't connect those two.
Probably not. Now, the research is ongoing to fully understand the mechanisms, but multiple large studies have shown a correlation. Higher ejaculation frequency over a man's lifetime seems linked to a lower risk of developing prostate cancer.
Any theories why?
Well, proposed theories include the idea that regular ejaculation helps flesh out potential carcinogens, or maybe it reduces inflammation in the prostate gland, which is thought to be a factor in cancer development.
Interesting.
So this point elevates solo sex potentially from being just about pleasure or stress relief to having this preventative health dimension, specifically regarding prostate cancer, which is obviously a major health concern for men over 60.
That's a compelling message.
It is. The takeaway is, don't be afraid of this area and recognize the potential health benefits linked to regular ejaculation.
The experts also give some practical advice around this, too.
Yes, very importantly, they strongly recommend discussing any concerns or even just interest in prostate stimulation with your doctor.
Crucial first step.
Absolutely paramount.
Yeah.
Just to ensure there are no underlying conditions that might make exploration risky and to get personalized advice. They also note the existence of tools made specifically for prostate stimulation for those who are open to exploring more.
Okay.
Which kind of acknowledges that exploring prostate pleasure is a recognized part of male sexual anatomy. Products exist to help you do that safely and comfortably. Again, reinforcing that this isn't some fringe or shameful thing, but a valid area of self-discovery.
This really ties sexual activity directly to general health in a very concrete way, potentially quite impactful.
Yep.
It's not just about sexual function in isolation. It's potentially contributing to long-term physical health, specifically prostate health. And that emphasis on talking to your doctor just keeps coming back, doesn't it?
As it should.
Reinforcing that sexual health is a legitimate part of overall health. It deserves professional discussion, especially as you age and your health needs get more complex.
Absolutely. Your healthcare providers are there for all aspects of your health, and sexual health should definitely be part of that conversation. Open dialogue means you get accurate info, guidance tailored to you. That's crucial when you're thinking about any new health-related practice.
Right. Okay, let's move on to mistake number 4. This one seems incredibly simple, almost too basic, maybe, but the experts stress it becomes non-negotiable, especially as men get older.
Mistake number 4, skipping lube. According to the experts, particularly for men over 60, this isn't just, a matter of preference. It's really presented as essential for comfortable and healthy solo sex.
And the main reason they give is directly tied to aging, hormonal changes.
Precisely. The key physiological reason cited is that as testosterone levels naturally drop with age, so can natural lubrication. It's not like a switch flips off, but it's a gradual decrease in the body's ability to produce its own moisture during sexual activity.
Okay.
And the delicate tissues involved, they rely on that lubrication to prevent friction. The consequences of friction without enough lube, the experts are clear and they sound unpleasant, can cause irritation, micro tears, or just flat-out discomfort.
Micro tears? That sounds painful.
They're tiny rips in the skin's surface. Might not even be visible, but they can cause soreness, stinging, and they also increase the risk of infection. And just chronic irritation can lead to inflammation and pain.
So what might have just felt less smooth when you were younger could actually cause pain or minor injury later on.
That's the gist of it.
And the simple fix recommended is just use lube every time.
It really is presented as that fundamental. Given the decreased natural moisture and the potentially increased tissue sensitivity, lubrication becomes a necessary baseline. It prevents discomfort, prevents potential damage.
Makes sense.
And the experts provide some helpful practical advice on types of lube, too. They suggest water-based lubricants are a safe bet.
Why water-based?
Generally hypoallergenic, easy to clean up from skin, clothes, sheets, and they're compatible with almost all sex toys and condoms, safe all around.
Okay.
They also mention silicone-based lasts longer, especially in water, so good for maybe showers or longer sessions. But there's a crucial caveat. Might not play well with all toys.
Oh, right.
Specifically, silicone toys. Silicone lube can degrade silicone toys over time, so you need to be careful with combinations.
Good tip. And a strong warning about certain ingredients, too.
Yes, this is important, again, given the increased sensitivity of aging tissue. They explicitly warn to skip anything with fragrance or warming agents. Those can be irritating.
Why is that?
Fragrances have chemicals that can be harsh on delicate mucous membranes, can cause burning or itching, and warming agents. They work by creating a mild chemical reaction. Feels pleasant to some, maybe, but it can be overly intense and irritating to older, thinner tissues.
So keep it simple.
Stick to simple, body-safe ingredients is paramount for comfort and just preventing bad reactions.
It seems like such a minor detail just adding a product, but clearly the experts see it as absolutely foundational. For comfort, preventing issues like soreness or those micro tears, and ultimately just maintaining the ability to engage in solo sex without negative consequences.
It removes a physical barrier and protects delicate tissues.
Simple but essential.
It is absolutely fundamental. It's a straightforward adaptation to a physiological change that makes a huge difference in comfort, safety, and the potential for continued pleasure. Ignoring this simple step, it can turn what should be a positive stress-relieving activity into one that causes physical discomfort, maybe even minor injury, and it's so easily avoidable.
Okay, on to mistake number 5. This one feels less about a specific physical technique or a product and more about a approach mindset.
It definitely shifts gears, yeah. Mistake number 5 is treating it like a race. Yeah, rushing the process, having the sole focus be just reaching orgasm as quickly as possible, almost like, ticking a box, getting it done.
And the experts strongly recommend a fundamental shift in perspective here, especially for men over 60.
They frame it beautifully, actually. They suggest that solo sex, just like partnered sex, really is about pleasure, connection, and relaxation.
Not just the finish line.
Exactly. And they emphasize that this reframing is particularly relevant as we age. That youthful energy, maybe performance pressure, that might have driven a quicker, more goal-oriented approach that often gives way to a different relationship with time and pleasure later in life. The experts suggest that aging actually gives you an opportunity to appreciate the process of arousal and sensation, rather than just fixating only on the endpoint, the orgasm.
So moving from a purely goal-oriented mindset to more of a process-oriented or maybe experience-oriented one.
Exactly that. Instead of seeing solo sex as just a task to complete efficiently, it's presented as an experience, something to be explored, savored.
How do they suggest doing that?
Well, the suggestions offered for slowing down are pretty practical. They encourage a deeper engagement with your body and mind. Things like take your time. Obvious but important. Explore your body.
Right.
They even suggest incorporating other elements like breathing techniques, music, even massage into the experience.
So making it more holistic.
Yeah. And these aren't just fluff add-ons. They're presented as ways to really enhance sensory awareness, reduce any performance pressure you might feel, and just deepen the connection to the physical and emotional sensations that arise. Breathing techniques, for example, they can help activate the parasympathetic nervous system. That promotes relaxation, which is absolutely crucial for arousal and blood flow.
And the experts claim there are tangible physical benefits to this slower, more mindful approach, beyond just making the experience potentially more enjoyable.
This is where it gets really interesting. They actually cite doctors who report that taking a slower, more mindful approach can actually boost libido and improve erectile strength.
Boost libido and improve erections by slowing down. That seems counterintuitive.
It might seem that way, right?
Yeah.
Shouldn't rush and get things done faster. But it connects directly to your physical and mental state. Performance anxiety, that pressure to achieve or maintain an erection or reach orgasm, that's a huge factor in sexual difficulties, especially as men age and experience natural changes in function.
Okay.
By deliberately slowing down, focusing on sensation and pleasure instead of the outcome, you reduce that anxiety and that relaxed state. It's far more conducive to healthy blood flow, which is essential for getting and keeping an erection.
So it's not just psychological, it's physiological too.
Yeah.
By reducing the finish line pressure, you actually create a better physical environment for arousal and function.
Precisely.
So framing it as an opportunity to enhance overall pleasure and sensation rather than just focusing on duration or speed.
Exactly. It's a holistic benefit. It's about treating your body, your sexual experience, with patience and respect, allowing yourself to fully inhabit the sensations. And in return, the experts suggest, you might find improvements not just in the quality of the experience, but maybe even in the physical capacity itself.
Wow.
It's a prime example of how your mindset directly impacts your physical health and function.
This really underscores that interconnectedness, doesn't it? Mind and body, especially as we age. Adapting your approach actually yields better results than just sticking to old habits that don't serve your body anymore. Okay, mistake number 6. This tackles something critically important, maybe often overlooked in the context of sexual health specifically, and that's overall systemic health.
Yes, mistake number 6 is failing to consider or maybe address underlying health conditions when you're experiencing changes in sexual function.
And the experts list specific conditions that are frequently cited as impacting male sexual health, particularly in older men.
They list several significant and common ones: diabetes, hypertension, that's high blood pressure, depression, and various medications.
Okay, a common list for older adults. How do they affect sex life according to the sources?
They explain how these factors can affect sex life. They say they can affect your sex drive, stamina, and orgasm quality.
Can we break that down a bit? How does something like diabetes affect things?
Well, according to the material, diabetes, for instance, can damage blood vessels and nerves over time. Both of those are absolutely crucial for erectile function and for sensation.
Right.
Hypertension, high blood pressure, affects blood flow generally, making it harder for enough blood to get into and stay in the penis for an erection.
Okay.
Depression. That can significantly lower libido, just your general energy levels. And it can also affect your ability to actually experience pleasure.
And medications, that's a big one.
Huge. Many common medications prescribed for age-related conditions, things like blood pressure meds, maybe some beta blockers, antidepressants like SSRIs, even some allergy medications. They can have sexual side effects.
Like what?
Anything from reduced desire to difficulty with erection or problems with ejaculation.
This is such a crucial point, because changes in sexual function or sensation are often not just isolated sexual health issues, are they? They can be important symptoms or consequences of bigger health problems or treatments.
Exactly. And the experts include a really strong warning here, one that's critical for men over 60, they say. If you notice significant changes during solo sessions, things like difficulty getting hard, lack of sensation, or delayed orgasm, they explicitly state, don't just brush it off.
That warning feels delivered with real emphasis in the material, clearly because these changes can be signals.
They absolutely can be. These changes warrant investigation because, as the material states, they could be a warning sign for something bigger.
Bigger like what?
Well, erectile difficulties, for example, are pretty well known now as a potential early indicator of cardiovascular problems.
Heart issues showing up there first.
Sometimes, yes. The arteries supplying blood to the penis are smaller than those supplying the heart. So blockages, or maybe poor endothelial function, often show up there first. Changes in sensation could indicate nerve issues, maybe related to conditions like diabetes or neurological disorders. And that lack of drive, or delayed or absent orgasm, could be linked to depression, hormonal imbalances, or, as we said, medication side effects.
Which circles right back to the experts repeatedly stressing, communicate with your doctor.
This is arguably the most vital takeaway from this particular point. Talk to your doctor isn't just presented as an option. It's framed as a necessary step when you experience changes in sexual function.
Because it's a medical issue.
It's a legitimate medical concern. It deserves professional attention. And it could be something relatively simple, easily managed, like needing that medication adjustment the material mentions. Sometimes just switching to a different drug in the same class or adjusting the dose can fix the sexual side effects without messing up the treatment for the main condition.
Or it could be more serious.
Or it could prompt necessary investigation into an undiagnosed condition. Your body functions as this interconnected system, right? Sexual health isn't often its own little box. It's deeply intertwined with your overall physical and mental health. Ignoring changes related to sex means potentially ignoring important signals about your wider well-being.
It profoundly reinforces that idea, doesn't it? That taking holistic care of your general health, managing chronic conditions, being aware of medication side effects, addressing mental health that is fundamentally taking care of your sexual health too.
Absolutely.
And talking openly about these changes with a healthcare provider is just crucial for accurate diagnosis, appropriate management, not just for the sexual issue itself, but potentially for detecting and managing more serious underlying health problems early.
Precisely. It's about seeing the full picture of your health, understanding that addressing one part often positively impacts others.
All right, we've reached the seventh and final mistake identified by the experts in their material. This one feels less about a physical or purely medical issue, more about internal feelings, maybe societal influence.
It certainly shifts into the psychological and emotional realm, yeah. Mistake number 7 is experiencing shame or guilt about engaging in solo sex. The experts acknowledge that for many men, this point hits deep.
And that depth, that feeling of shame or guilt, it likely stems from ingrained societal attitudes, wouldn't you say?
Absolutely. The material explicitly confirms that. There's still a significant stigma around older men and sexuality.
Yeah, you hear it all the time.
Our dominant cultural narrative often links sexuality so strongly with youth, maybe procreation, a certain image of physical prowess. As men age, they might internalize this idea that, well, this part of their life should just fade away.
Or that it's somehow wrong or embarrassing.
Right. Or that engaging in solo sex is somehow undignified, maybe a sign of desperation, or only for young people. These societal pressures, they can lead to feelings of embarrassment, isolation, or guilt about what is actually a natural and healthy behavior.
But the experts push back against that.
Directly and powerfully. They counter this stigma with a core statement: sexuality doesn't retire.
I like that. Sexuality doesn't retire.
It's the central message meant to challenge that internalized shame. They frame sexuality as a lifelong human need and capacity. It evolves, but it doesn't just disappear.
And they reinforce this message by going back to the concrete positive health benefits, right? The ones consistently cited by doctors, according to the sources.
Yes, they reiterate that a healthy, engaged sex life, and that includes solo activity as a valid form of expression, it offers tangible benefits beyond just pleasure.
Such as?
Well, regular sexual activity, including masturbation, is linked to things that boost mood, improve sleep, reduces stress levels, and even strengthens immune function.
Those are not trivial benefits.
Not at all. Improved mood fights, depression, anxiety, reduced stress has huge positive effects on cardiovascular health, immune health. Better sleep supports overall cognitive function, physical restoration. Experiencing pleasure and physical release through solo sex is presented not just as self-indulgence, but as a legitimate form of self-care.
Self-care with demonstrable health advantages.
Exactly. Advantages that are particularly valuable as you age.
So the expert's message here is really one of clear validation, acceptance.
It's very strong and compassionate, I think. They state plainly, pushing back against any potential inner critic or external judgment. You've got nothing to feel guilty about.
That's pretty clear.
And they're inclusive about who this applies to.
Yeah.
They deliberately mention various life circumstances to normalize it. Whether you're single, partnered, or just reconnecting with yourself after years of not paying attention, it's okay. This is a healthy part of life.
That feels important, explicitly saying it's okay, regardless of relationship status.
It validates the act itself. Engaging in solo sex is presented as a normal, healthy human behavior that continues throughout your lifespan, regardless of your situation or past habits.
This final point really seems to encapsulate the importance of psychological well-being and sexual health. Shame, guilt, they can create huge internal barriers, right?
Right.
Leading to anxiety, avoidance, maybe just a diminished capacity for pleasure.
Absolutely.
So it's about actively challenging those internal narratives, those societal pressures that try to dictate when and how your sexuality should exist. Framing solo sex as valid self-care, self-exploration, pleasure at any age, free from judgment. That feels like a fundamentally healthy perspective.
And it's a brilliant point to end on, actually, because addressing the psychological barrier, it can unlock your ability to implement solutions for the other mistakes we discussed.
Oh, so?
Well, think about it. If you feel shame about solo sex, are you likely to explore it mindfully and gently like we talked about in Mistake #5? Probably not. You might avoid using lubricant, Mistake #4. Because maybe it feels too deliberate, too medical, or just unnatural within that shame framework. You might be really uncomfortable even considering exploring prostate stimulation, Mistake #3, because the whole area feels taboo or somehow wrong.
Ah, okay.
And crucially, feelings of shame or embarrassment. They are massive barriers to discussing changes in your sexual function with your doctor, Mistake #6.
That connection is so clear when you lay it out like that. Shame isn't just an unpleasant feeling. It's a psychological roadblock. It actively prevents men from adopting healthier practices and seeking necessary help.
It can be profoundly limiting. Recognizing that feeling, acknowledging it, and then actively challenging that internal narrative. That's often a foundational step toward embracing healthy sexual aging with confidence and curiosity.
All right, that takes us through the 7 crucial mistakes regarding solo sex for men over 60, as identified and elaborated upon by the experts in the sources we reviewed. Let's just quickly recap those points.
Okay, the 7 significant points distilled from the source material are:
using excessive pressure or overly rough techniques. That can lead to desensitization and irritation.
right, gentle finesse.
2, over-reliance on pornography, which could potentially lead to difficulty with natural or partnered arousal because of how it conditions the brain.
Balance visuals with internal focus.
3, ignoring prostate health. It plays a key role in pleasure and potentially in reducing prostate cancer risk through regular ejaculation.
Don't ignore it. Talk to your doctor.
4, skipping lubrication. Absolutely crucial to prevent irritation, microtears, and discomfort as natural lubrication decreases.
Non-negotiable, basically.
5, treating solo sex like a race. Instead, adopt a mindful process focused on pleasure and sensation, which can also improve function.
Process over outcome.
6, ignoring underlying health conditions or medications. These might be the real root cause of changes in your sexual function.
Talk to your doctor about changes.
And 7, feeling shame or guilt about solo sex, despite its proven benefits for mood, sleep, stress, and overall well-being.
Let go of the stigma. And it's really important, I think, to reiterate the overall message that kind of ties all these points together. The tone from the experts, it feels like one of empowerment, awareness, encouragement, not judgment or shame.
Absolutely. The core intent of this information, as it's presented in the material, it isn't to criticize, it's to empower. It's about encouraging men to, as they say, embrace their bodies with awareness, care, and confidence as they age. It emphasizes that staying sexually healthy, fulfilled over 60, it isn't about denying the changes that happen or trying to relive your youth.
Right.
It's about intelligently understanding what healthy looks like today, not necessarily what it looked like 30 years ago. It means adapting techniques, paying attention to your physical and mental health as one integrated system, and shedding any outdated, limiting beliefs about sexuality and aging.
Being proactive.
It's about actively participating in understanding and navigating the evolving landscape of your own body, your own desires.
So this deep dive was specifically designed to provide you, our listener, with a shortcut. A shortcut to these important insights pulled straight from expert perspectives rather than leaving you to sift through maybe conflicting or confusing info out there.
Yeah.
Hopefully, hearing these points laid out, hearing them explained, helps you identify areas that maybe resonate most strongly with you, or perhaps highlights aspects of your own health or your mindset where focusing some attention could be most beneficial on your personal journey, your journey of aging well and staying connected to your vitality.
And maybe, just finally, let's reflect on that powerful statement the experts made. Sexuality doesn't retire. We've talked about the physical, the psychological aspects of healthy solo sex, as outlined in these sources, but maybe consider what truly embracing that idea means for you.
Beyond just the mechanics.
Yeah. It's not just about maintaining physical function.
Yeah.
How does staying connected to your sexual self influence your emotional landscape, your sense of vitality, your potential for intimacy with a partner if you have one? Does understanding these healthy solo practices maybe open up possibilities for richer connections elsewhere in your life? Or does it simply deepen the connection you have with yourself? It's kind of a provocative thought, isn't it? That attending to this often very private aspect of health can actually resonate outwards into your broader sense of well-being.
That's a fantastic and expansive point to leave with. Thank you for joining us for this deep dive into expert perspectives on male sexual health over 60. We really hope it's provided valuable information and practical insights drawn directly from the materials you shared with us.
Hope it was useful.
Keep asking questions. Keep exploring what healthy aging means for you in all its dimensions. And keep being curious about how to live fully at every stage of life. Stay strong, stay curious, and stay connected to your body and yourself.